So we've just finished a very long consultative process and included a survey, and we surveyed across 17 different Pacific Island countries and asked them about the status of emergency care in their countries. So it's fair to say, on the whole, there's a lot of gaps. There's some countries that have got some trained staff to deliver emergency care, doctors and nurses, and there's some countries that have got some good equipment to deliver, effective resuscitation and life support. But on the whole, most emergency departments aren't that well built, aren't necessarily safe environments. A lot of places aren't collecting enough data about emergency care, and certainly in a pre-hospital care, if we're talking about emergency care as pre-hospital and in facilities, then most countries don't have a pre-hospital care system in their country. So there's a few good developments, but on the whole a lot of gaps. So one of the stats which surprised me a bit was about triage. So triage is just the sorting of patients as they arrive for care in a facility into the most urgent priority to the ones that are safe to wait until there's somebody available to see them. And what we found was that only 18% of clinicians that responded to our survey reported that they were consistently and reliably using a triage system in their hospitals. So that's not very many. Yet triage is a really essential component of safe and effective emergency care. And the other one was about data. So more than 90% of Pacific Island clinicians reported that they couldn't access reliable data about the emergency care burden in their hospitals. And then finally, the other statistic was about pre-hospital care systems. And I've got a stat here that said only 9% of Pacific Island clinicians reported that they had some kind of centrally dispatched ambulance system. So less than 10% have a system where you can call up and then have an ambulance come and attend to you. So the pre-hospital system's quite underdeveloped in most places. Yeah. Yeah, so part of the process of defining what was going on at the moment, the current status, was then to talk about, well, what are the priorities for development and what are the standards that we think Pacific Island clinicians think are realistic standards to achieve. And so together through a big consultative and consensus process, all the stakeholders have come up with a whole roadmap really of standards for improvement across the main building blocks for development, which are human resources and training, building up the workforce. So they've made some standards about how many doctors and how many nurses should be trained in emergency care at the hospital level, district and also provincial or divisional hospital level. And then the other building block was infrastructure and equipment. So there's some ideas about what kind of how you should design a resuscitation room and what are the basic equipment and drug lists that are required. The third standard was about processes, so things like triage, having a recognised triage system that should be applied and is applied across every facility in every Pacific Island country, but also things like clinical guidelines, other kinds of processes. Data, so that everyone agreed that there should be a basic standard for every patient who gets recorded with the triage category and their presenting complaints, so that we can start getting information about the burden of emergency care disease that exists across the whole Pacific. And the final building block for development going forward is about leadership and governance. And so it's about recognition of emergency care as a really important component of the healthcare system, an essential component, and recognising it as a distinct specialty. Okay, so the main partners that we've been working with in the Pacific has been through our personal networks, and because the Pacific Island Society for Emergency Care is just a new organisation that's just getting formed now. So that'll be the organisation that'll drive all of this forward. But we've had clinicians network throughout the country, and then the external partners, I suppose, have been through the Australasian College for Emergency Medicine. SPC, I should say, have driven the whole process, funded through DFAT. And also the research that's required to get all of this information has been approved through Monash University. So they're the key kind of external partners that have been involved, but it's really the key local champions and local stakeholders who'll need to drive it forward. Yeah. Oh, the meeting's incredibly important. Emergency care on the whole hasn't really been well recognised or well understood across the Pacific region. This is an opportunity to highlight the importance of it, that it addresses every single acute health need across every discipline. So this is a great platform to be able to explain what emergency care is, talk about the work that's happened from the grassroots up to define the needs and also the roadmap, and then make the networks with not only the Pacific health leaders but all of the other partners that are going to be crucial to driving things forward. So it's a fabulous meeting.